73% of women can only orgasm through clitoral stimulation. 73%. And yet, almost no one, not your OBGYN, not your gynecologist, not the internet, is having an honest, clinically grounded conversation about what oral sex is actually doing to your vaginal health, or your mouth. If you are a woman over 40, this information could genuinely change how you approach intimacy, how you protect your body, and how you finally fully understand what is happening inside you. So today we are going there. All of it. The pleasure, the risks, the biology, and everything in between. Welcome back to Women's Sexual Health. I'm Dr. Rebecca Ross, certified women's sex therapist with over a decade of clinical experience working exclusively with women on sexual health, intimacy, desire, and everything the medical system often forgets to tell us. This channel exists because too many women walk out of their doctor's office with unanswered questions, dismissed concerns, and zero information about how their bodies actually work when it comes to sex. That ends here. If this is your first time on the channel, welcome. And if you haven't already, please subscribe right now. Hit that button, because every single week I bring you research-backed, clinically grounded conversations about women's sexual health that you are not going to find anywhere else. New episodes drop every week, and you do not want to miss them. Now, let's talk about oral sex. What actually happens during oral sex before we get into the physiology? I want to take a breath and say something important. Oral sex is one of the most common sexual practices among adults. Studies from the National Survey of Sexual Health and Behavior show that nearly half of women over 40 report receiving oral sex regularly. Nearly half. And yet it remains one of the most under-discussed topics in clinical sexual health, especially for women in your demographic. So let's be clinical, let's be clear, and let's be completely shame-free. Oral sex, specifically cunnilingus, that is, oral stimulation of the vulva and vagina, involves direct contact between one person's mouth and another person's genitals. That contact creates a biological exchange, moisture, bacteria, pH, microorganisms. This is not a reason to fear it. This is simply a reason to understand it. Because when you understand what is happening in your body, you are empowered. You can make informed decisions, you can protect yourself, and you can experience more pleasure. That is always the goal on this channel. So let's start with the good news. What oral sex does to your vagina. The pleasure science here is something I tell my patients all the time, and it never stops being important. The clitoris is not a small thing. Most people think of the clitoris as that small external nub, but that is just the tip. The full clitoral structure extends internally, wrapping around the vaginal canal with 2 bulbs and 2 crura reaching deep into the pelvis. The entire structure is roughly the size of your thumb, and it has approximately 8,000 nerve endings, more than any other part of the human body. When oral stimulation begins, here is what is happening physiologically. Blood rushes to the vulva and vaginal walls in a process called vasocongestion. The external clitoris engorges and becomes more sensitive. The vaginal walls begin to produce natural lubrication through a process called transudate, fluid seeping through the vaginal walls in response to arousal. The inner labia swell and darken. The vagina itself lengthens and expands to prepare for potential penetration. All of this happens within seconds of effective stimulation. And for many women, especially women over 40, oral sex triggers this response more reliably than penetrative sex alone. Why? Because the clitoris is the primary organ of female sexual pleasure, and oral stimulation targets it directly. That 73% statistic I opened with, that comes from multiple large-scale studies including the OMG research project and data published in the Archives of Sexual Behavior. Nearly 3/4 of women require direct clitoral stimulation to reach orgasm. Not penetration, not indirect pressure, direct stimulation of the clitoris. For women over 40, this is particularly significant. As estrogen levels decline in perimenopause and menopause, penetrative sex can become less comfortable. Vaginal tissues may thin. Lubrication may decrease, but the clitoral nerve pathways remain. Sensitivity often increases. And for many women, this phase of life brings the most reliable orgasms they have ever experienced, particularly through oral sex. That is not a coincidence. That is biology working in your favor. The vaginal microbiome, what no one warns you about. Now, here is where I need to put on my clinical hat, because this is the conversation almost no one is having, and it is one of the most important things you can know. Your vagina has its own ecosystem. It is called the vaginal microbiome, and it is a carefully balanced community of bacteria, primarily a species called lactobacillus, that maintains the vaginal pH between 3.8 and 4.5. That slightly acidic environment protects you from infections, keeps harmful bacteria in check, and supports overall vaginal health. Here is the problem. Saliva disrupts that environment. The human mouth is home to hundreds of bacterial species, including Streptococcus, Fusobacterium, and other organisms that are completely normal in the mouth, but have no business being in the vagina. When saliva enters the vaginal environment, it introduces foreign bacteria and temporarily raises the vaginal pH, making it less acidic and less protective. For some women, this has no noticeable effect. Their microbiome is robust and recovers quickly. But for others, particularly women who are already in perimenopause or postmenopause, it can trigger a shift in the microbiome that leads to bacterial vaginosis or BV. BV is the most common vaginal infection in women of reproductive age and beyond. It is not a sexually transmitted infection, it is a disruption of the vaginal microbiome, a shift in bacterial balance. Symptoms include a strong fishy odor, gray or white discharge, and sometimes itching or irritation. Research published in the Journal of Infectious Diseases found that unprotected oral sex was associated with BV recurrence in 30 to 40% of women studied. This is not a small number. Here is what I tell my patients. If you experience recurring BV and you cannot figure out why, your sexual practices, including oral sex, may be a contributing factor. So what can you do? First, know that barrier methods, specifically dental dams, significantly reduce this risk. A dental dam is a thin sheet of latex placed over the vulva during oral sex. They are underused, underrated, and genuinely protective. Second, after oral sex, allow your body to rebalance. Avoid douching. Do not disrupt the vaginal environment further. Some women find probiotic support, specifically oral and vaginal lactobacillus probiotics, helpful in maintaining microbiome stability. Third, if you are postmenopausal, pay particular attention. Estrogen supports lactobacillus dominance in the vagina. When estrogen declines, the microbiome is already more vulnerable. Speak with your healthcare provider about vaginal estrogen therapy if recurring infections are an issue. What oral sex does to your mouth. Now let's talk about the other side of this conversation. Your mouth. Whether you are giving or receiving oral sex, there is a mouth involved. And mouths are not sterile environments. So let's talk about what the research actually says. The most significant clinical concern here is STI transmission, and I want to be direct with you, because I know this is something many women, especially women over 40 who may be re-entering the dating world after divorce or loss, are not thinking about. Several sexually transmitted infections can be transmitted through oral sex. These include herpes simplex virus, both HSV1 and HSV2, gonorrhea, syphilis, and HPV. That last one deserves particular attention. HPV, human papillomavirus, is now the leading cause of oropharyngeal cancers, that is, cancers of the throat, tonsils, and base of the tongue. According to the CDC, HPV is responsible for approximately 70% of oropharyngeal cancers in the United States, surpassing tobacco as the primary cause. Most people associate HPV with cervical cancer, but its oral transmission is a growing and underreported public health concern. Here is the reality check. Only 9% of women over 45 report ever being counseled on STI risk by their OB/GYN. 9%. If your doctor has not discussed this with you, you are not alone. But now you know. What can you do? Get tested. Regular STI screening is important at any age, particularly if you have new or multiple partners. Talk to your healthcare provider about HPV vaccination. Yes, it is available for adults, and yes, it is worth discussing. Use barrier methods. Dental dams for oral vaginal contact. Condoms for oral penile contact. These are not mood killers. They are tools for sustaining a healthy, active, pleasurable sex life for years to come. And if you experience any persistent sore throat, unusual mouth sores, or throat discomfort after sexual activity, please see a doctor and mention your sexual history. The over 40 difference. Why your body responds differently now. This brings me to what I consider the most important section of today's episode. Because everything I have shared so far exists within a specific biological context for you as a woman over 40. Your body is not the same body it was at 25, and that is not a problem, that is just biology. But understanding those changes helps you make better decisions and have better experiences. Let's talk about genitourinary syndrome of menopause, GSM. This is the clinical term for the collection of physical changes that occur in the vulva, vagina, and urinary tract as estrogen declines. It affects up to 50% of postmenopausal women, and yet fewer than 25% ever bring it up with their doctor. GSM includes vaginal dryness, thinning of the vaginal walls, reduced natural lubrication, increased sensitivity or discomfort during penetration, and in some cases urinary symptoms. None of this is inevitable, none of it is permanent, and none of it means your sex life is over. In fact, here is something I find genuinely exciting to share with patients. For women experiencing GSM, oral sex is often more comfortable and more pleasurable than penetrative sex. It does not require lubrication in the same way. It does not cause friction on thin tissues in the same way. It directly stimulates the clitoral nerve pathways, which remain intact regardless of menopausal status. Many women in their 40s, 50s, and beyond describe experiencing their most reliable orgasms ever. Not despite menopause, but in the context of it. Because they understand their bodies better. Because they know what works. Add to this the fact that postmenopausal women are increasingly entering new relationships. Data from AARP consistently shows growing rates of sexual activity in women over 50, and it becomes clear why having accurate clinical information about oral sex is not optional. It is essential. Let me bring everything together for you. Oral sex is one of the most effective pathways to orgasm for women, particularly for women over 40. The biology is clear. Direct clitoral stimulation produces reliable arousal, lubrication, and climax in a way that penetration alone often does not. At the same time, oral sex introduces the vaginal microbiome to foreign bacteria, which can disrupt the delicate pH balance and contribute to infections like bacterial vaginosis, especially in postmenopausal women whose estrogen-supported microbiome is already more vulnerable. STI transmission through oral sex is real, underreported, and underdiscussed, particularly HPV and its link to oropharyngeal cancers. Regular screening, honest conversations with your healthcare provider, and appropriate use of barrier methods are your most effective tools. And for women navigating perimenopause or postmenopause, oral sex may be one of the most important tools in your intimate life, offering pleasure, arousal, and connection in ways that honor your body's current physiology. Knowledge is not the enemy of pleasure. Knowledge is what makes pleasure sustainable, safe, and completely yours. If this episode helped you understand your body in a new way, please share it with a woman in your life who needs to hear it. Leave a comment below. I read every single one, and your questions often become future episodes. Subscribe if you haven't already. And if you want to go deeper on any of the topics we covered today, vaginal microbiome health, GSM, STI prevention after 40, check the links in the description. I have resources down there for you. Thank you for being here. Thank you for taking your sexual health seriously. Because you deserve accurate information, you deserve pleasure, and you deserve a doctor who tells you the truth. I'm Dr. Rebecca Ross. I'll see you in the next one.